Good afternoon, and today we have a pleasure of interviewing my friend Marcy Silver. She's a speech and language and feeding pathologist. Good afternoon, Marcy.
Good afternoon, Dr. Sokolina.
And thank you very much to our audience. We appreciate your questions and your comments on our site. And if you know somebody who have a sleeping trouble, sleep next to the snoring partner, please click the like and share button. If you're a medical professional like Marcy, please use our channel as a networking ground. This way together we can find and put all the puzzles of sleep and breathing disorders together and find the custom solution for our patients. Over the years, working with a lot of patients who suffer from obstructive sleep apnea or other sleep and breathing disorders, I learned what not one solution fit all. And on my channel, I try to provide the support for people who suffer from those diseases. Also, find a different adjunct therapy what can help you to get better and hopefully find the cure. So, good afternoon, Marcy again, and I'm going to tell a story how we met. We met actually, thank you to Scott, thank you to your brother, but we met based on my search to refer my friend who had a tongue tie, and I suggest him to have a tongue tie release. And for that, I refer him to Marcy, who practice with him myofunctional therapy to prepare him for the procedure and to make this procedure successful. So now my friend have a totally new ability with the tongue, and he's very happy, and tongue got stronger. And actually, regarding him, he used to have a really moderate sleep apnea, and recently we did the sleep study, and he doesn't have a sleep apnea anymore. So thank you, Marcy. My first question to you, and as a big proponent of myofunctional therapy, I would like to find out, Marcy is a speech language pathologist, but also she does myofunctional therapy. As a specialist in that area, I would like to know, what's the difference between speech therapy and myofunctional therapy?
Okay, the difference between myofunctional therapy and speech therapy is that with myofunctional therapy, we teach you how to breathe, chew, and swallow correctly. And with speech therapy, we work on the sounds themselves and the placement of our tongue, our cheeks, and our lips. So we work on sound production.
A lot of people who explore the option of myofunctional therapy want to know what exactly myofunctional therapy, how long it takes before you see the results. So what's the course of action you're offering to your clients and patients?
So I offer a 12-week program, and it's once a week, and I provide you with 8 exercises per week. And, the results are, if you do it one time a week, if you do it one time a day, it's very different than if you practice 3 times a day. So it's all about the practice and bringing it into your everyday life as well. And if after the 12 weeks, we should see results, there may be a maintenance program. And we look back at what areas still need that improvement. And that's how we would work from there. And it could go from, once a week to every other week to once a month to once every 3 months. So it's not a one-size-fits-all program.
I would like to ask you, they have to do 8 exercises a day. How long they should practice? Like if they practice twice a day, how long it would take? 5 minutes, 10 minutes to do the 8 exercises?
Yeah, it totally depends. It's a very, it depends on your schedule, but it's very important that, we do, I might tell you 3 times you do it or 10 times you do it, or I need, you to do it 60 times in a particular exercise. But yes, you should do it, I would say 1 to 3 times a day.
Like 5 minutes, 10 minutes? Or you cannot say?
I would say about 10 minutes a day. 10 minutes each time you do the exercises.
So it seems so easy, but I know it's not. But I have a question. If, we have a lot of patients who breathe through the mouth. At least I see them in my practice. And if patient realize, my mouth is dry, probably I breathe with my mouth, or maybe I'm, with the mouth open on certain pictures. What specialist should mouth breather seek? Or is it okay to breathe through the mouth?
It is not. Mouth breathing, we need our nasal passage for so many things. We need it to attend to tasks. We need it to smell. We need it to calm down. We need nasal breathing gives us a chance at calming. So nasal breathing it's very important to be aware of our open mouth breathing. And I'm very practical in my approach. I like to, talk about what your day looks like. If you're at the computer, I want you to try to close your mouth, 3 times while you're at the computer. It's a very simple, practical strategy is recognizing your mouth breathing and shutting your lips to breathe through your nose.
It's so not easy. And I want to bring to our audience, I want to tell a little bit about Marcy. But Marcy, she's certified speech and language pathologist who also have myofunctional training. So she looked at the both things. And she has extensive education, including Columbia University, where she served as a faculty as well. And additional to that, she took myofunctional therapy classes. And she provides therapy at home. So she traveled and in schools and in the community-based settings. And as a gift to our audience, she offered 30 minutes introductory sessions where she can assess the situation. And we're going to put Marcy information in under the interview. And you can contact Marcy and get her personal approach towards the situation you are dealing with. So I would like to ask you, Marcy, a lot of patients who come to my practice, even more so after COVID, where people really clench their teeth, they complain on the pain in temporomandibular joint. Tell me how myofunctional therapy can help with the teeth grinding and TMD pain.
So TMD is caused by tongue position. We need to have an appropriate tongue position for our jaw to be relaxed. If our tongue is resting in a position that it's not supposed to, we're going to have pain. So myofunctional therapy is a very effective treatment for TMD. And we do tongue exercises and massage on your jaw and strengthening. So our tongue needs to be resting in our home, which is our palate. The tongue needs a home to stay. The tongue is not at home when it's outside our mouth. Our tongue is not at home when it's kind of sitting behind our teeth. The tongue needs to be up and back so that it can be at home, so it can give you relief. When you're here, your tongue and you're all in your teeth and your jaw, that is not home. That is it's very painful. So or myofunctional therapy would be a great outlet for the TMD patient.
I would like to ask you why it's so important. It's kind of related to previous question. Why it's so important to chew on both sides of the mouth, and even more philosophical questions. What number one body priority? I know we always talk about eating, but maybe you can give us a different light on that, and why teeth are so important for that.
Yes. So, as a speech language pathologist, we are trained. Eating is not the number one priority. Breathing is our body's number one priority. So without good oxygenation, we can't eat. We don't have good oxygenation, we can't swallow. And on top of that, we also need good postural stability. In order to function in the world, we need good postural stability. So what I see is a lot of people eat in the front of their mouth. We need to bite and pull our food. Bite and pull our food on both sides of our molars. And when we do that, neurons fire to our brain. And so it's very important for our equilibrium, for our balance, for muscles on both sides of our body, for our back, for our diaphragm. Super important. So nasal breathing strengthens our core muscles to sit up straight. Our tongue in the right position develops our core strength. If our tongue is out, it pulls our whole body forward, which then causes neck pain, back pain, etc. And last, we need good postural stability to move our muscles in our mouth and to increase loudness level for projection.
I really like that term, what you use, postural stability and like oral posture, because I find a lot of connection with disorders in the mouth and the postural disorders as well. A lot of people come with that domino effect. They start in the mouth and, slowly neck and shoulder pain goes to spine and hips replacement and knee replacement. So I see the correlation 100% on that. Now, I would like to ask you, it's very hot topic. How facial maxillofacial therapies can help with the snoring? So how exercise, is that real?
It is real. I think that, we work as a speech therapist and as a myofunctional therapist. We're looking for mouth closure. So our lips, when we have a snoring difficulty, our mouth opens and we're just trying to breathe. Well, we're not using our nose to breathe. So lip closure is super important for snorers throughout the day. So starting with when you are awake, so that you are aware that your mouth is open. We need to close it. When we close our mouth, it forces us to breathe up our nose. We may not be able to do that, right? Because we have blockage. So you're going to start by blocking one nares and pull the air up and then breathe out the other nares. So
great exercise.
Do that. So it's very important to train your nose to breathe, because some people never learned to breathe through their nose because they've had enlarged adenoids or they've had enlarged tonsils, which automatically drops your jaw.
I would like to ask you, when you mentioned about chewing on the both sides of the muscles, or the both sides of the mouth, I know you have a special tubes and you show it to me. Maybe you can show it to my audience, what they know, how they can accomplish.
Sure. So actually, I'm a speech therapist who works with children as early as 4 to 6 months when they're learning how to eat. So the bottle and the nipple, we go from suck, swallow, to, as soon as we give them solid foods, their mouth starts to go up, down, up, down, up, down. Well, they're getting a mixed message if we're putting the food in the front of our mouth, or we have the pacifier too long or the bottle too long. So we use these chewy tubes to teach them to chew on the sides of their mouth. And I use this with adults too to strengthen the cheeks. So the muscles that we learn for eating are the muscles we learn for speaking. So if there is any difficulty at a young age, we're going to see it later. So for example, if we don't use our cheek muscles to chew, we are going to have weak muscles here. But if we chew on the sides of our mouth, we are moving wee, wow, oi, ay. Our cheeks are strengthened in order to get it back for speaking, but also for eating hard, meaty foods.
I would like to ask you, you talk about that, very common term called mouth yoga. Why mouth yoga is important?
Yeah, mouth yoga is important because just like we go to the gym to work our arms, to work our legs, to do squats, to work on our stomach muscles, our mouth is our muscles too. So if we're not using them correctly, or we're not working them and strengthening them, they are going to be weak, which then impacts so many things. It impacts feeding, it impacts snoring, it impacts our sleep, it impacts our attention and focus. So our tongue has 8 muscles in a concentrated area, which helps us speak, eat, breathe, calm down, because it's connected to the vagus nerve, which is our calming nerve. And if we were not in the right position, we're not going to have that feeling if it's not being worked correctly.
I think that area been really overlooked for so many years, and we need to get back to basic. Yes, the tongue is the strongest muscle, and that's gonna relate to my next question. Can orthodontics be done without myofunctional speech therapy? What's your opinion from your experience, from a lot of experience you had?
Yes, no, it is not recommended that orthodontics are done without speech therapy, without myofunctional therapy. Form follows function. So if our teeth are not in the right position, it's because our tongue had pushed those teeth where they're not supposed to be. So I have to teach where to place the tongue and strengthen that tongue and have control over that tongue so those teeth don't go back to where they were before. And that would be called a relapse.
Yes. And none of the retainers, from my experience of doing ortho for the last 20 years, gonna work if your tongue wants to be in a certain spot. Tongue can break any type of retainers, doesn't matter what material we're gonna use. So yes, I think it's so important what specialists like Marcy work together with the multidisciplinary team, with orthodontists, to accomplish real results what's gonna last for the years to come. So my question to you, why so many people need speech therapy these days? What's the philosophical underlying cause of that situation?
Well, I would say that it is nasal airway difficulties. So that would be enlarged adenoids, allergies. Adenoids are cause inflammation. That's where inflammation is stored. So that would be one reason why we have speech therapy. Enlarged tonsils, ear infections, and then we have lip and tongue ties as well. So there's many things that can cause, and then we also have contraptions that they're selling on the market that aren't good for our oral motor cavity, such as different kinds of pacifiers, different kinds of bottles too long, pacifiers too long, the bottle reliance, pacifier reliance. And then also they're selling sippy cups that cause your tongue to suck in the wrong position. So I recommend straw cups and regular cups for our lips and our tongue.
I would like to ask you, why tongue tie is so bad?
Tongue ties are bad because, again, they used to diagnose mild, moderate, severe tongue tie. However, now you're either tongue tied or you're not tongue tied. And your tongue might impact you when you're an infant, such as their difficulty feeding, they're showing reflux behaviors, they're having trouble latching. That's when we really find the lip and tongue tie. However, it can affect us later. Like a mild tongue tie can pull our whole body forward, and we need, neck. We have a lot of neck pain, or we have a lot of back pain. So tongue and lip ties will affect us in so many different ways, and affects patients in so many different facets.
I would like to ask you as my last question, can you please show us your toys, your practical tips for our audience, maybe to how to hold the lips together, get aware of that?
Sure. So I have a tongue depressor here, and it's very important. We can rest it in our lips. You should be able to hold it. Now, if you can't, you have to work your way up. Then we need to strengthen those lips because they're loose, because they have not been together. We can add pennies, like weights that we do at the gym. and you should be able to add those pennies. So holding a tongue depressor while you're watching TV or while you're at the computer, it can be functional. You don't have to just, sit and do it. You can, relate it to your everyday. I have the chewy tubes. Those are really important. Chewing on the sides. Okay. And then I have a straw that you pull your tongue back and you hold it here. So it pushes your tongue into the position that we want it. The tongue tip needs to come up, and that gives it support. That gives it help. And you're feel free to follow me on Instagram. I always post different, oral motor
Tricks and
activities
tips.
that are good for all patients.
Yes. Thank you very much, Marcy. We appreciate, and our audience can use the 30 minutes gift what you provide, and they can find you through different social media. We will put all your links in our comments section. And thank you very much for your time. We really appreciate that.
Thank you so much. I appreciate being on here. I had a great time.